I'm joined by Lilith, paramedic and founder of NHS 100,000. Good evening.
Hello, thank you for having me on.
I'm pleased to see you, and I have been covering this story because I do believe in freedom of choice.
Yes.
And I have come to understand that even if you have had 3 jabs, you can still catch the virus and you can still pass it on. You had a march on Saturday.
Yes.
How many people attended that?
Quite a lot. It looked like a couple 100,000, I believe. Yeah.
Well,
maybe not.
Well, those
I'm very terrible,
that organise marches always over-exaggerate. Now, look, Lilith, you are being irresponsible, you are being selfish. You owe it to your patients to get yourself vaccinated because they will in turn be safer. That is what the government is saying to you.
It is what the government is saying. I think the core issue of this is the ability to choose. So whether you choose to be vaccinated or not, what the government is saying is that these vaccines are quite effective in protecting you from this disease. So in effect, you should be protected from COVID. So the patients that we deal with should be comfortable in knowing that their vaccine works for them. For us, it's more about the issue of being able to choose. So for whatever reasons that we've all chosen not to take the vaccine, to be vaccine-free, what we want is we want people to have that ability to choose in the end, regardless of the consequences, because the most important issue in health is that we do value the patient and their choices, whether or not it's good or bad.
But the argument has to be that you should not be able to put those patients in any more danger than they're in already.
And they're not. We've been working through a pandemic with no vaccinations, poor PPE, and now that we do have PPE available and we do have very good infection control procedures, which we do follow, this is the main way to stop COVID spread.
As a paramedic, how often do you test?
So, funnily enough, we don't test very frequently. It is...
And what about a nurse? How often would they test?
So I believe nurses test twice a week. Yeah.
Okay.
I think for us as paramedics, I think the problem came with finding a certain viral load after infection, which caused positive results. So that's why we stopped testing, because the problem with the NHS at the moment and with the ambulance staff is that we don't have enough staff to cover shifts. So the more that you're testing positive, the less that we're on road. And I think managers saw that, so they kind of reduced the urge to test.
The care sector saw, we don't know whether it's 20 or 30 or 35,000 people left the care sector because they didn't want to get the vaccine. Yeah. You're clearly prepared to lose your job if it comes to it.
Yes.
Do you think you can win this battle against the government?
I would like to think so. There's a big uprising for, just for choice. Even people who have chosen to be vaccinated or not, we do value choice, and it shouldn't ever be forced, because it might start off with the COVID vaccines today. Tomorrow it could be the flu vaccines, which doesn't have a high uptake in the healthcare sector. Next might be taking aspirin every single day to protect you from blood clots.
This is a bigger question. This for you is a question of liberty as opposed to this vaccine itself.
Yeah, absolutely.